Okay, so now we're going to program the monitor. In order to do that, you do the V sequence. So we'll try it again. And it goes into patient, new patient. Of course, you enter the information in that you received from the LifeVest network as far as the patient's name. Be sure and check the settings. That's very important to make sure that the settings are correct in here according to whatever is on the initial LifeVest work order. Second part is that you put the C code in, which identifies that particular physician who ordered it. So after that, you go into patient training, and we'll go through the sounds and the bells and whistles of the monitor. The first alert you're going to hear is the siren. If the siren goes off, that means an abnormal heartbeat has been detected. If you are conscious and alert, you must press the response buttons to delay the treatment.
Treatment has been delayed. Bystanders, do not interfere.
If a person goes into full-fledged cardiac arrest, they will go unconscious. At that time, if it's identified they're in full-fledged cardiac arrest, within 35 seconds they will receive a life-saving shock. In addition, obviously the individual will not be able to delay the treatment because they're unconscious and unable to.
Treatment has been delayed. Bystanders, do not interfere.
However, sometimes if an individual goes into ventricular tachycardia or ventricular fibrillation for a second or two and snaps out on their own, so they go 1, 2 a second, they regain consciousness, so they just snap out real quick. But in the interim, it's already triggered the siren. So that's why it's very important. As long as the patient, the individual, is conscious and alert, they must hit the response buttons to delay the treatment.
Treatment has been delayed. Bystanders, do not interfere.
If this, more often than not, a siren is triggered due to artifacts which are generated by the fit. If the fit is not snug on the patient, or it's loose, or sometimes if you get a very large individual, those electrodes are bouncing off, and it's sending an EKG that's not conducive to their own EKG. So, as long as they're conscious and alert, they must hit the buttons. If the siren goes off and you feel okay, call the 1-800 number. They can do a quick extraction and see what the potential issue is, instead of sitting there wondering what it is. Okay? So, this time I'm going to let it play through in its entirety so you get kind of a time frame of start to finish when a treatment would be initiated. So we'll say you're unable to hit the buttons, you're unconscious, the siren is going off, the vibration box would be going off in conjunction with the siren, which obviously you would not feel at this time.
Press response buttons to delay treatment. Press response buttons to delay treatment.
At this time, the blue gel will be deployed out of the paddles at this stage.
Bystanders, do not interfere. Call ambulance.
Just received the treatment. It's very important that you are the only one that manages these buttons. If someone runs to your aid and you're unconscious, non-responsive, and the siren's going off and they hit the 2 response buttons, they've just delayed the treatment, which at that time you don't want the treatment delayed because obviously something cardiac-wise, as far as ventricular tachycardia and ventricular fibrillation, has occurred. If you're touching the patient when a treatment is deployed, you will get it too. That's why it indicates bystanders stay clear. Each battery will deliver up to 5 treatments. This device is 98% effective on the first treatment to get the person back. So the minute a treatment is given, it's thinking, is this person still in that lethal arrhythmia? If they are and they're still unconscious, they will receive another, go through the same sequence, they will receive another treatment or shock in 35 seconds. The minute you receive a treatment, how do you know if you received the treatment? If you're alone, that's not an issue. You will regain consciousness. The device will say treatment has been given. It'll keep saying call an ambulance. The most telltale sign is that blue gel will be all over you. You will feel it, you will see it. Once you see that, and this says treatment given, you call 911 immediately. Keep the life vest on. Okay, so that's the siren. The other alerts on here are gongs. Gongs are good. Gongs are strictly mechanical. You'll see the lights are not illuminated red. When this is plugged into the life vest belt, it's one circuit. Any of these components come off your skin or are loose and not snug, you'll receive a gong. Simply look at the screen. When you hear a gong, it will tell you what area needs attention. In this case, it's saying one of the round electrodes is not on your skin or has interference. If you have a question on what to do, obviously you check the 4 electrodes. If you have a question on what to do, you can touch the question mark. You can read it or touch the screen again and he'll talk
Make
to you.
sure round electrodes touch your skin. Nothing is between the electrodes and your skin. Garment fits snugly.
Snug fits the best fit. So it monitors all 4 of your electrodes to make sure they're in good contact with your skin. If you hear a gong and you look down, one of your paddles has interference. Typically the ones on the back aren't an issue because they're nice and flat. Once in a while this one underneath the left chest, maybe you'll get a blanket or something in between the paddle and your skin. If you have a question on what to do, again, you can touch the question mark, you can read it, touch on top of the screen,
Make
and he'll
sure
talk to you.
metal mesh touches your skin. Therapy pads are inserted properly. Garment fits snugly.
Again, the snug fit is the best fit. The third gong is if it says check belt. Which I just will get to here in a second. The third gong is check belt. If you hear a gong, you look down, it says check belt. Again, you can touch the question mark, touch on top of the
Remove
screen.
garment and belt. Check for proper assembly. Clean electrodes.
And I'll get to that.
Put on garment and belt. Ensure proper fit. See patient manual. If problems continue, call Zoll Life Corps.
And to clean the electrodes, just take alcohol and a cotton ball and just rub them off periodically. Typically, every time that you change to a fresh garment, just get them rubbed off just to make sure there's nothing on there as far as perspiration or skin. Okay, the fourth and final gong is if your battery life runs too low, it will remind you to please change the battery with a gong. Okay, that's it. Oh. Here's the holster that it goes into. Simply slides in. So your top's exposed, your 2 response buttons are exposed, your back and your front one, and display screen. Battery's on the top. Velcro's down. Ways to wear it, belt clip. I'm losing my voice. Belt clip. One side of your neck or shoulder. One side of your neck, please number horse collar. Person fall, you gotta cut it. Trips out, it'll strangle. That's it.